Good afternoon. Welcome to the daily briefing at the EMA staff in St. Clair County. Joined here today by Chairman Mark Kern, who just got off of his telephone call. Welcome, Chairman.
Welcome.
And then, of course, Sam Bierman from the Health Department. And Sam is the number lady.
Yes, more numbers today, new numbers. Numbers have climbed just a little, but I think we're still in a good spot. So as of today, 5,402 tests have been performed in St. Clair County, with 961 of those being positive, which is an increase of 35 from yesterday. And that includes both males and females under the age of 10 up to their 80s. We are at 4,388 negative test results, with 53 test results still pending. And unfortunately, we do have some additions to the amount of deaths we have today. We are reporting 73, which is an increase of 2 from yesterday. And the first was a male in his 80s who did have underlying health conditions. And the second was a male in his 90s who also had underlying health conditions. And as always, our thoughts and prayers go out to those families. For those who have completed the IDPH required 14-day quarantine, we are at 548. And for state totals, we are at 672,020 tests that have been tested, with 102,686 positive test results, which is an increase of 2,268 from yesterday. And we are at 4,607 deaths for the state, which is an increase of 82 from yesterday. And as always, our condolences go out to all the families throughout the state. For hospitalization numbers, and these are for hospitals that are in St. Clair County, we are at 53 patients admitted due to COVID-related reasons, and one of those patients is currently on ventilators, which we have not been down to one for quite a while on the ventilator list, so that's
a good thing.
It's a good thing. For congregate living facilities that are in outbreak status, and that is 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, Brea of Belleville has 23 cases and 2 deaths. Brea of Cahokia has 8 cases and no deaths. Caritas Family Solutions in Belleville has 11 cases and no deaths. Colonnade in O'Fallon has 4 cases and no deaths. Four Fountains in Belleville has 104 cases and 20 deaths. Help at Home in O'Fallon has 5 cases and no deaths. Knollwood Retirement Center in Caseyville has 7 cases and no deaths. Lebanon Care Center in Lebanon has 51 cases and 9 deaths. Memorial Care Center in Belleville has 43 cases and 5 deaths. New Athens Home for the Aged has 4 cases and no deaths. St. Paul's Home in Belleville has 16 cases and 4 deaths. Swansea Rehab and Care Center has 5 cases and no deaths. And finally, TDL Incorporated in Belleville has 4 cases and no deaths. And I will turn it over to Chairman Kern for his update.
Great, thank you, Sam. So, as we just heard, our numbers continue to indicate that we will be heading into phase 3 of Governor Pritzker's plan to reopen Illinois. So that's a good thing. In our area, we seem to be doing all the right things. So without something unexpected, I do believe that we'll be opening up to phase 3 the end of the month. So what that means is that barbershops, beauty salons will be allowed to open again. Manufacturing and retail all are included in that phase. The governor also added something that was a little unexpected, that outdoor seating, outdoor dining would be allowable for restaurants and liquor establishments. So that's a real positive thing. And we've been fielding calls. We're going to do everything we can to work with those establishments to make sure that they have everything they need to get open, so we get the business community starting to roll again in St. Clair County. So those are good things. We've been waiting for that for a while, and so it's almost here. We're looking forward to the 29th of May, that's for sure. So at this time, we'll go into the zip code report. Remember, if you don't hear your zip code mentioned, doesn't mean that there is no one in your zip code that is diagnosed with COVID-19. What it means is the level in your zip code has not risen above the level of 5 yet. So in 62201, we remain the same at 13. 62203, we remain the same at 34. 62204, we've increased 1 to 37. 62205, we've increased to 41, which is an increase of 2. 62206, we're now at 88, that's an increase of 2. 62207, we're now at 65, that's an increase of 3. 62208, we're now at 55, that's an increase of 1 person. 62220, we're now at 105, that's an increase of 5 people. 62221, we're now at 81, that's an increase of 2. 62223 remains the same at 44. 62226 is now at 113, that's an increase of 2. 62232 is now at 17, that's an increase of 2. 62239 remains static at 11. Also 62243 remains the same at 7. In 62254, we've actually seen a decrease of 2 to 26. And as we explain every time, sometimes that's because a person checks in the hospital, they don't have the right zip code. There are many reasons why those numbers can go the other way. So today we see a decrease in 62254 by 2. In 62257, we remain the same at 7. 62258, we remain the same at 14. In our newest zip code, 62264, we've gone up again. We've gone up 2. Now we're at 8. In 62269, we're at 63. That number remains the same. And in 62285, we also remain the same at 8. Today, we're lucky to have HSHS St. Elizabeth's Hospital Lab Manager, Justin Cox, is here. And I think we got some interesting things to talk about today, Justin. First of all, give us an overview. How are things at the hospital? Are you continue to run at full steam? Are you seeing a little light at the end of the tunnel, perhaps, for a while?
Yeah, I would say it's definitely, thank you for letting me come back.
Sure.
I do definitely appreciate it. So one of the things that we did see is definitely an increase in our testing volume, whether it be COVID related or even non-COVID testing related. So it seems like the community is starting to kind of get back out in the public, and one of the things that kind of helped us was bringing back the elective procedures.
So talk about the testing results and what percentage of results are you responsible for in the process at HSHS?
So they say a physician based their diagnosis, about 70% of their diagnosis is based on just laboratory results. So definitely important information that we provide to the provider.
So you at your hospital in the lab that you have, you're mainly processing the tests that has the long swabs. And are you seeing supplies coming in, the test availability, all those hurdles that we had the last time you were here pretty much have been overcome?
I would say we're still encountering some issues, I guess, with either the reagent or the medium that they actually place the swabs in, or even the swab. So we've been very fortunate to be a part of a system, and we're able to share resources. So that's one good thing about being part of HSHS, the Hospital Sisters Health System, that we're able to share these resources and reagents.
So you're not only, since the hospital has opened up for all procedures now, you're doing a lot more testing, because you aren't just testing people who have COVID because they're in the hospital for COVID reasons. You're testing because they're going to come in for elective surgery.
Correct.
Right?
Yes, sir. So we actually have a streamlined process for the patients that are coming in for elective procedures. So starting last Monday, we actually have a process where if your procedure's within 3 days, we actually have kind of a drive-through clinic where the patient doesn't have to leave their vehicle. Our nurses will actually go out to the vehicle, swab them, as you said, the brain test where they take the swab, and it's actually the PCR test, and then we'll have the results within a couple of days in time for their procedure to make sure that they can have that elective procedure.
And that test is really the most, or considered to be, kind of the gold standard test.
Yes, sir. It is still the gold standard as of right now. I know there's a lot of research and development going into like the blood tests, but as of right now, it seems like PCR is the gold standard for
And the reason that St. Elizabeth's is doing this is because it's part of an entire program so people know they're safe when they're coming in for elective surgery. They should not hesitate to use the hospital for other services other than COVID-19 because of the testing you're doing and the other precautions you're taking.
Yeah, and it seems like we're putting measures in place for patients that were to walk in, and we make sure every patient, whether they're a visitor or actually a patient, that they have a mask on. They're getting the screening test or screening questions. They're taking their temperature right at the door. So we want to make sure that our patients are truly safe when they're being treated, and whether they're there to be treated or whether they're there to visit somebody. So.
And there, if you go in for elective surgery, you're not going to be in the person in the next room isn't going to be being treated for COVID-19.
Sure. So, and like I said, we do take precautions if a patient were to be positive for COVID-19. So there's a kind of a team of nurse that takes care of them. And then obviously there's special PPE that they use. So make sure there's no cross-contamination, which seemed to be a big issue whenever the COVID-19 outbreak first started within the United States.
So if people hesitate to get elective surgery, are they, what about donating blood? That's important. That remains an important part of healthcare. Are those numbers down?
So actually there's always a need to donate blood, and I don't think people realize that you can actually donate blood every 8 weeks. We actually have a blood drive coming up on June 9th. Here at the hospital, and so the MVRBC, which is our Mississippi Regional Blood Center, they're our blood supplier. So they're always looking for opportunities to get more units of blood in their inventory, so they'll have it on hand. We've been really fortunate to have awesome staff members and a community to help donate. So the last 2 blood drives that we've hosted, a couple of impromptu blood drives, have been completely booked. So as of right now, the one on the 9th, we have 17 openings. So I don't think those will last very long. But as of right now, it's but there's always a need to donate.
So we're encouraging people to try to be one of the 17, but even beyond that, there are other opportunities.
Yeah, they're all over the place. So there's if you go to bloodcenterimpact.org, it'll show every blood drive. And the good thing about MVRBC, the Mississippi Valley Regional Blood Center, they're located in Missouri, Illinois, Iowa, and I think even Wisconsin. So there are many sites that you can actually go to on the donor centers, and then there's also the mobile blood drives. Similar to the mobile blood drive that's on June 9th, they actually bring a mobile unit, which kind of looks like a big RV that's specialized to donate blood, and they take the precaution. You have to schedule your appointment. They do not allow walk-ins. All the beds are strategically placed so you're not, so you have the 6-foot distance between every patient. So it's really a neat procedure.
But so let's just expand that discussion a little bit. So now that COVID-19 is around, there's an opportunity to give blood if you have had COVID-19 for a positive reason.
So yes, sir. So the MVRBC is actually using a clinical trial that's been developed with the FDA and Mayo. So what this is, we're looking for convalescent plasma. So they call it like CCP, but COVID-19 convalescent plasma. So plasma kind of being the liquid portion of your blood, it makes about 55% of your blood. Those patients that recover from COVID-19 will develop these antibodies, and they're in that plasma or water portion of or liquid portion of your blood. And then we're actually using this liquid part to treat the patients with active COVID-19. So like I said, it's a clinical trial, but we've already actually started doing that at St. Elizabeth's Hospital.
So you're creating the plasma, and you're actually using it at St. Elizabeth's as part of a trial.
Yeah, so as of right now, we're asking people that recover from COVID-19 to contact the blood center, and they can actually set up appointments. And those people that donate plasma can actually donate once a week instead of waiting 8 weeks like a unit of blood. They can actually donate every week, and it can actually produce 3 to 4 units of the CCP. So once they do that, and if we have a patient that needs it, a provider can actually order it. We can get it through the MVRBC, get it to our lab, and then with the help of the physicians, the nursing staff, the pharmacy staff, and the lab staff, we can actually arrange where these patients are getting basically antibody-rich plasma.
And is plasma by blood type, or does that go away once you create the plasma?
So there is actually a back type for plasma. So, but as of right now, we take any type of blood donor type for plasma.
So to drill into this just a little bit more, you're actually using this for people who are sick,
Right.
but you haven't seen anything come out of that yet.
It's relatively recent. We on May 8th was our first unit that we had transfused. Since then, we donated or issued 4 more units, so a total of 5 units so far. And it's so new. We still we're working with obviously Mayo. And, I believe the pharmacy tech will even actually enter the data 7 days later to make sure to see how the patient's recovering, because all this data is so new. We're kind of analyzing to see if is it value added or what's it really doing.
So, and that's one thing that we get mixed answers on. What is recovery? What is the definition of recovery? Is it a second test that then comes back negative?
So as of right now, the MVRBC quantifies a recovered patient as a person who has gone 28 days after being diagnosed as well. So 28 days without signs or symptoms. They have to be at least 17 years old to donate. And then you have to have a positive COVID-19 in your chart. So have to have a positive in your chart from the PCR test. You have to be asymptomatic or recover 28 days later, and then, like I said, be 17 years old. So those are kind of the 3 criteria that justifies you as being able to donate.
But you don't test people again.
So yeah, so actually, and then that's kind of another thing that they could do. If you're 17 years old, have a positive PCR test on file, and then you actually go back and have a negative test, then it's only 14 days after that test to consider you recovered.
But without that negative test, as long as they're asymptomatic for 28 days, they qualify.
Yes, sir. Yep.
And it's just a continual learning process.
Yes, sir. Absolutely, and it's neat to be kind of a part of this whole thing, because there's so many moving parts and it seems to be never ending. But I'm just very fortunate to be a part of an awesome team.
Well, we want you to come back when you get the exciting results and give us the first scoop as to how that plasma's working.
Awesome. Sounds good.
Great. Thank you, Herb.
Yeah, what a interesting to be a part of that, and just think if there's some patients out there that could give a little of that blood and they find something that will work. I mean, how good that would make that patient feel.
Right.
So
right. I just urge people to go to that blood center impact.org, and they can check it out to see if they do qualify for that criteria, because there is definitely a need as of right now.
So do your antibodies get stronger if you've had a worse case of COVID?
And see, that's kind of new also. So obviously when you're first exposed to something, you develop this thing called an IgM antibody. Then after a prolonged time and you start to recover, you develop an IgG antibody. So it's kind of like those IgG, that there was long-standing antibodies that we're needing for those patients that have an active infection. To kind of, I guess, we're trying to initiate the healing process or recovery process quicker. And as of right now, we don't know what level that is. We don't know what level of IgG you need to be immune. We don't know what level you need to not be re-exposed. So, like I said, it's still pretty new news.
That's why it's a trial.
Yes, sir. Yes, sir. Absolutely.
and we're waiting to hear the results of that. I'll tell you, it's really interesting. Thank you for coming in today, Justin.
Thanks,
Appreciate it.
Justin,
Thank
very
you.
much. We appreciate it.
And on the EMA side today, we had 15 departments come in and pick up more of the PPE equipment. And received some more equipment in today also. And I wanted to take just a few minutes today. There was a couple of comments that was posted on the messages last night about, all we do is sit around and wait to do these daily briefings. And boy, that would be nice if that was true. So I just wanted to put together some facts to share with everybody who follows us to let you know what the staff does here while we're waiting to bring you the up-to-date information. So far since this started, and this is our 69th day, I believe, that we've been doing this, we've provided 11,320 N95 masks to our first responders, to some of the first medical people, doctors, dentists, you name it, anybody who's needed them, we've been able to help them. 25,770 surgical masks, 2,043 sets of goggles, 1,608 bottles of sanitizer, 12 boxes of gloves, medium, 74 boxes of small gloves, 193 boxes of large gloves, 200 boxes of extra large gloves, something we had trouble getting a lot of the gowns. We've now given out 1,749 of them, 424 gallons of bleach, 69 5-gallon buckets of disinfectant, 88 no-touch thermometers, 19,594 hand sanitizer packets, 2,504 8-ounce bottles of the hand sanitizer, 503 face shields, and 435-gallon trash bags to our first responders, like I said, and numerous other departments. So amongst hundreds of phone calls, conference calls, so we stay busy.
So those things don't just drop out of the sky.
No.
You know, you, Herb, and your staff here, Brian, Randy, and Sam at the health department, you're trying to access these goods from a myriad of locations, and then you try to seek reimbursement so that we don't have to raise taxes to pay for it, that we get funding to pay for these things, so we not only protect the county, but we do it in a fiscally responsible manner.
Right, and we can't forget Rick, our man who's running the logistical room downstairs, Rick Seibert. Tammy, our young lady here, does the sign language for us, and Cindy and Daisy. So it's a teamwork. I like to call it Team St. Clair, and you are all a part of Team St. Clair by doing your part, by staying at home, practicing social distancing, good personal hygiene, and helping us get into phase 3, which we're really excited about. So we'll be back here tomorrow afternoon at 3:30 with our next briefing. Cindy and Daisy will be here in just a few moments to translate this into our Spanish communities. Thank you and have a good evening.